Jessica at that time, and everyone can participate. And it'll be recorded. This session will be recorded today, and please enjoy the refreshments in the back of the room as well. Today's speaker, Jessica Kolzicki, she serves as Judson Senior Living's Executive Director of Community Life and Dementia Care Specialist. Jessica has a Bachelor's of Science in Art Therapy from Bowling Green University. She is a Certified Activity Director specializing in memory care from the National Certification Council for Activity Professionals. She has served on the Northeast Ohio Association of Activity Professionals Board and has worked for Judson for almost 24 years and has several roles during her very long tenure with Judson. Her current position allows her to both combine her skills, talents, and techniques with her compassion for engaging seniors. In working with the community life directors, that would be Darlene here at South Franklin, she helps to support their creativity and partnerships in the community. She leads efforts towards our Comfort Matters accreditation annually by teaching this approach to all associates in orientation. She offers weekly dementia education to associates and families and works with the team on specific interventions to help support persons living with dementia. Jessica serves on all three of our Judson campuses and communities, and our committees such as Associates Matter Workforce Committee, the DE&I Committee, and the Memory Care Committee. She lives in Medina with her husband and 2 children, and she's involved in her church and its ministry. She also loves to be outdoors with her dog, family, 3 rabbits, and 6 chickens. She loves to boat as well. I know I say, how do you take care of all those chickens and animals on top of kids and everything you do? But please join me in welcoming Jessica for her discussion this afternoon.
Well, thank you. And if at any time you can't hear me, raise your hand and I'll get this mic a little closer to me. I thank you all for having me this afternoon as the second educational speaker in this 5-part series. 2 weeks ago, some of you, or maybe all of you, had got the opportunity to hear Dr. Amanda Lapia speak on normal aging. And so today, my presentation is, my memory isn't what it used to be. Is that okay? And I'm here to tell you today that it is okay. It is a normal age-related changes that happen to us, just like our physical, our cognitive changes with age. And so today what I'd like to do is share with you our overview. It's going to change for me. Nope. Here we go. All right, so I am going to talk a little bit about what age-related changes are and kind of discuss maybe some other possible reasons why we sometimes feel confused. And then I'm going to touch base on the 10 warning signs, just in case that confusion becomes a little alarming and concerning. And so the Alzheimer's Association has wonderful resources, one of them being the 10 warning signs. And then I will follow up with what is dementia? And then touch base on the 3 major stages of dementia. And I think it's important to kind of look at what's happening to our organ, our brain, along with what we see on the outside, because sometimes it can be very different. And so I'd also like to then review assessing care needs, because we constantly do that. We do it kind of throughout our whole life as we change, we grow, we assess what our needs are, mind, body, and spirit. They're always evolving, and so it never stops just because we're aging or just because we may be diagnosed with something new. And so that's really important. I'm going to also talk about what does a successful plan look like, especially if you are diagnosed with a disease that causes dementia. And then finally, I will talk a little bit about tips that you can use or share with other people, especially if you know others in your life that have dementia. And then we'll go over some questions at the end. So I hope some of you can see this slide, but by a show of hands, how many of you have been in this person's situation? Do you see the lady in the middle? She's kind of peering across the parking lot. She can't find her car, right? Can't find where she parked her car. How many of you have experienced that? Yes, almost everybody, right? And I'm here to tell you that that is a normal thing. Even my 17-year-old daughter can't find her car when she parks it, when she comes out of the mall. And there's a few reasons for that. It's because we're either hurried and we're trying to think of the list that we have going on in our brain of what we have to purchase in the store, or because we're multitasking and the phone just rang right before I got out of the car and I'm not going to answer it because I have to call that person back. And so your mind starts to race. Or it's you're running a little bit late, and so the people that you're meeting at the movies are anxious, and you start to get anxious. And so you forget where you parked your car, because by the time you leave and you're coming back out, all of those things that have happened, that's a natural response. And you have to take a minute and retrace your steps and figure out, where did I park the car? So some things are very natural. That's normal because of those things that I mentioned. And so let's take a little bit of a deeper dive into age-related, because things can change as we get older. And things that are age-related changes are forgetting people's names. It's on the tip of your tongue. You know it, it's right there. But it takes a minute and it'll come to you. Or you make occasional errors in the things that you've always done, but you quickly realize that and you're able to fix it. Okay, that's normal. How about if you're getting confused about the day of the week? When did I have lunch with Sally? And then you have to think about what you were doing the day before and what happened the day after that. And, oh, yeah, I think it was Wednesday. It was last Wednesday. You can kind of look back based on the cues of your life. All right, so sometimes you have trouble finding that right word. And it's not a name or a date, but you just can't figure out what the name of that is that you're trying to describe. It just eludes you. That is also a very normal thing that happens as you age. It just takes longer, and I bet when you're brushing your teeth before you go to bed, it pops in your head. And so other things like misplacing items, and everybody here probably has set their car keys in not the regular spot, and then you go, shoot, where did I put those? And that's okay. It's when you start to find those keys inside the peanut butter jar, inside the freezer, that maybe we have to have a talk, okay? And so sometimes feeling also uninterested, things that you always were first at, or you signed up for those things, or you were really excited to be with family at a reunion, but you know, as you get older and you get a stressful week, or other things start to happen in that week, and you're looking 7 days from now saying, I don't know, it just seems a little too much, and I'm getting a little bit overwhelmed, and I'm just gonna bow out. And that's okay too, because not only is your body aging, you tire a little easily, you might not be you can't rebound as fast as you used to in your 30s or your 40s or your 50s. And that's all normal. That's okay. And so sometimes what happens after you start to think, well, okay, I've done those things, that's all normal. But then some people say, but I just feel like something else is going on. Now it's kind of concerning. I'm a little more alarmed. And so what happens is it's a good opportunity to check in with your loved one, somebody that knows you pretty well, ask questions or share that with other people that you trust and you know. Consult your doctor, because there are other reasons, like I have listed here, for feeling confused. And it may be beyond age-related change, like stress, really overwhelmed with maybe a transition in your life or a loss of somebody. It can also be because you aren't sleeping as well. That also happens naturally as we age, but then if you become stressed about it or you're overthinking, you can't turn your brain off and now you're sleep deprived, right? You have this consistent week or two or a month where you just can't sleep a good 6 hours, or you're waking up and your sleep cycle is broken. That can add to confusion. It can add to not feeling right and feeling more alarmed about it. Information overload. I would say we're in the height of multitasking. We have so much technology. So not only is our life a little crazy, but now our phone's ringing, emails are piling up. It can be really stressful and add again to that level of confusion. You think you're answering and really handling things, but it can be very overwhelming and it can cause even more confusion. Changes in medication. If there's an infection going on in your body, that can also increase confusion. And that is something that we pay attention to all along, because that definitely can add to delirium, which oftentimes we can get confused as dementia. So we really want to keep an eye on that. And even medical conditions, low blood sugar and changes in your medical diagnoses, that can also add to your confusion. Okay, so now we have age-related, and then we could possibly have some other things that are causing confusion that we want to check out, we want to share with other people. But now we've identified that maybe some of those things isn't really what the cause is. And now we're concerned that possibly I may have dementia. And dementia, I may say, is a symptom. Okay, you get dementia from a whole lot of different diseases that cause confusion, memory loss. And so this is the Alzheimer's Association list of 10 things that are warning signs. And some of these we've discussed, but really this is when you're forgetting and it's really interrupting your daily life. You're not functioning. It can challenge you in the way that you used to be able to set a plan and follow it, and now you can't get past this step 3. Difficulty completing familiar tasks. I'll tell you a story. I don't know if I've shared this in my other presentations, but my dad was diagnosed with mild cognitive impairment in 2010. And he had been working with his dad since the age of 13. And he was going to work on heating and air conditioning units. And eventually he took over the business from his dad. And he worked every day, and he was on call. It was his business. He was there when everybody was freezing or everybody was hot. And so he knew that job inside and out. And one day he got to that job and he didn't know what to do. It was a familiar task, something that he had been doing since he was 13. And yet it's like the start button was broken and he couldn't figure out what to do next. And so that's a big warning sign. And that's a good example of the familiar task that you do your entire life and now you're having difficulty. Confusion with time and place. Oftentimes you get turned around, but you really can't figure your way back. The cues, the signage, it doesn't help. That's a warning sign. Trouble understanding visual or spatial relationships. This often comes along with your gait. So you start to have difficulty with your balance. Being able to step over this cord as I'm walking around, that could be very detrimental to somebody who has Alzheimer's, the beginning stages. They may trip and they may fall, so that's a symptom to keep in mind. New problems with words. And this is more than just you can't recall it. It's about not being able to use the word in the right way, the right text. Your sentence becomes word salad, we call it. Predicate and subject get mixed up. And so trouble with writing, you may be able to not write a sentence any longer, becomes a design issue. Your brain sees structure not like it used to any longer. And misplacing things, again, we talked about the peanut butter jar with keys in the freezer, that's a warning sign. And then decreased poor judgment, withdrawal from the work or social activities, but to the point where everybody knows, gee, I haven't seen Sally in a long time, is she okay? It's not just bowing out for one or two activities. And then finally, mood and personality. This is big, especially with Alzheimer's. Somebody that was always very kind and considerate often turns the complete opposite. And so you want to, make sure that if that's happening, that's definitely something to address. All right, so dementia is the umbrella. It's the term that is really defining a symptom, but the number one is Alzheimer's disease, 40 to 70%. So it's the number one. And today in America, we have just about 6 million people diagnosed with Alzheimer's. And they say by the year 2050, we're going to be closer to 14 million. And primarily because age is one of the number one risk factors. And of course, we have a lot of the largest population aging at the same time. And so that's why those numbers are going to go up exponentially. Vascular dementia is number two. People who have had a stroke, that part of the brain is damaged. They may recover from the stroke, but later in life, we see damage and dementia as a sign of that stroke. And then there are other diseases like Lewy bodies, dementia, frontal temporal dementia. Bruce Willis was just recently diagnosed with that. And there's behavioral and language. There's two of those types. And like my dad, he falls under the category other. It was after a long series of tests and going to his neurologist and really monitoring his symptoms and the signs that he had, they finally diagnosed him with a dementia caused by chemical, not abuse, but he was around it. The Freon and all of the chemicals that were in his truck since the time he was 13, he was exposed to that. And back in the 70s and the 80s, they didn't have any regulations for monitoring what they did with those different chemicals that he needed for his job. And so we look at people who have brain trauma. They were in a car accident, or if they were playing football, boxers. These are all things that we've since learned really cause damage to the brain and eventually cause dementia. So we'll go through the mild dementia, just so you can get an idea. I love to put the picture with what we see on the outside, because as we go along into the moderate and the end stage, you really get a feel for what's happening to the organ, because sometimes people can be walking at the very end and you expect them to be a certain way and they can't, and they won't be able to. And so in the mild dementia stage, this is where people are repeating stories. They're very likely to forget the new information that you're giving to them because the hippocampus is down. And generally it's in that blue area that you see on the screen in that picture. And what happens is it's our short-term memory. And so when you introduce yourself or you learn new things, it goes there first to be stored and then sends it to the long-term memory. And so when that is failing, that's when people ask the same questions and they start to repeat or they can't remember the newest information. Along with very poor decision making, like leaving the stove on after they've been, done cooking. Those types of things that they would normally always know to do for safety. Again, language problems with finding the right word, and then they may become more depressed because a person probably knows there are changes, they recognize some signs, they're scared, and they become depressed, especially because they know they're not functioning to the level that they always have. And so functioning gets very difficult in their day-to-day. Driving, housekeeping, those things that just kind of come naturally that we do in our day-to-day are they no longer able to do. Moderate dementia. So this is where people start to have trouble not just with their short-term memory, but also their long-term memory starts to become affected. Oftentimes I see, mostly in the moderate, towards the end of that stage, if a woman is introducing themselves, they'll often give their maiden name, not their married name, because that is too recent. And so that's another example of that long-term memory disappearing. They're forgetting that personal history, and now they're not only forgetting where they put things, but they may be accusing others of taking it. Or they start to tear apart the room or rummage through drawers because they're panicking, they think it's stolen, or they just have no idea where it went. And so their, of course, mood is going to be a lot more upset, they're frustrated, they're angry. If you try to correct them, you'll hear about it, right? And so the function again starts to decline and the person is no longer able to dress themselves, brush their teeth. The bathing and grooming becomes very difficult because again, that takes sequencing, that takes action to complete the task. And it becomes harder for them to tell that they have to use the restroom or figure out how to sequence that, and so maybe more accidents begin to happen. So by the time the person is at the advanced stage, this is where the person is most dependent. They're not recognizing family members or any current or past events. They're unable to carry on a meaningful conversation. However, I will say it's amazing that the brain will always remember how a person makes them feel, and it will always be able to socialize, have that social cue. And even somebody who may not be able to give you much information or specifics, if you say, "Hi, it's Jessica, I'm so glad to see you," they go, "Hi." They can mimic that, and that is just a part of our brain that we hang on to the very end, just like our hearing is the last to go. And so those things are important when we're looking at how we're caring for the individual. So mood, I would say they're pretty fatigued. A lot of folks will say, "Well, I want my person involved like all the time. I want them to go to every activity, every meal. But sometimes I want to bow out and I need to step out. I need a break." And so for somebody who's at that advanced stage, we have to give them breaks. We have to give them rest because they're trying to do their best at what they have day in and day out, minute by minute. And so allowing some rest period while engaging and really assessing as we go is pretty important. And then function, really it becomes a full-time job to take care of somebody at this stage, because all of their systems are shutting down. With Alzheimer's, it starts in the brain, but then eventually it takes over the body. Where if you're diagnosed with Parkinson's or Huntington's, sometimes that starts with the body and then it ends with the brain. And so depending on what your diagnosis is, this may differ, but especially for somebody at the end stage of all of the diseases, it's very difficult. They lose their trunk muscle, and definitely their balance, even if they are walking. They really lose that spatial connection with the relationship of things in the room. And so we really have to monitor and assess the environment as well. Okay, so as I go into assessing, we are always assessing the person's needs. And if there's somebody in your life or yourself that you're saying, okay, well, I don't think it's just age-related changes, or I'm starting to worry about myself, I want to eliminate some things that could possibly be going on. And maybe you go to your doctor, and they may perform one of these 3 assessments: the SLUMS assessment, MOCA, and BIMS. And they all pretty much do the same thing. They want to check your orientation. They want to make sure your executive functioning, being able to plan and reason and follow, recall, all of that good stuff. And so they're able to tell if you have a lower functioning status, and there's numbers, like the SLUMS is 1 out of 30. And 30 being the highest and 1 being the lowest. But we also do this at Judson all the time. So upon admission, and then if you are, diagnosed, and we want to continue to assess you, we may do this test every 6 months. And it helps you, it helps the family, and it helps the team kind of know where you are on the trajectory of the disease. And so they come in very helpful. But that's not the only thing we assess. We assess functions of daily living. So are you able to groom, dress yourself, bathe, do your finances? And we're able to look at your lifestyle. Some of the things that you've always loved to do, are you able to do them? And if not, then how can we help you? And it might be that it's, a time for a transition. We try to help and support people in all levels of our care, but should you need a little more additional help, these are the tools that we use to share with you, that we think maybe we can bring in some additional help for you. And then it doesn't stop there. We talk with you. We want to know your goals, what you want for you. We want the family. We want the family to be involved, whomever you chose to be part of your care team. We want that information. That's really good to share. We want to be able to support, again, what you set out for goals for yourself. We look at adapting the change that's happening, your physical, emotional, and spiritual, because we're made of all 3 of those things. And so what types of support can be put in place for the person who has these needs and they're not able to meet them themselves? We look at the history, and we also take a look at if there's anything new that just happened. Okay, so those are all important things that we do during observation, assessment, and interview with you. Okay, so setting the stage for a solid, good, successful plan is great at any stage. As we're aging, people who choose Judson to come and live here, that's a good start to your successful plan. And so we continue to monitor that. We continue to meet with people and assess their goals and what types of things that are important to you. So engaging the team, looking at the person, the family and friends, the clinical team if you should need them eventually. It's important for that person to have that extra support. And sharing those diagnoses, as hard as it is, it's hard because having trouble thinking is a difficult diagnosis. It's going to change everything that you know, and it's going to change everything for your family. But to be able to share that and not burden it or just take it on yourself, or with your just immediate spouse or partner, and kind of spread that out to family and friends and the Judsons, the clinical team, the social worker, anybody that we can help get more resources for you. And those care conferences and meetings are really important to have. And I would go as far as to say the sooner the better. It's really important so that we can continue to set goals as the journey continues. We actually have them every 6 months in assisted living, and we generally have that as a recommendation because as we age, every 6 months can be really different. And so we can, even if nothing happens, even if it's, good news, we want to know about that. We want to be able to share in that joy with you. And to always remember the why. We keep the person at the center, and we look to see, are you as successful as you want to be? Whether you're just having, again, those age-related changes or there's something else going on, we want to be able to build that support and around the person so that they can have a great opportunity to do whatever their goal is. And so I like this visual. It's the bullseye. And I really like it because I think about the person in the center, and it's what's happening to you. And then the next set of people around you is your family, your close people that you want right next to you. And then maybe friends and neighbors, others that can be of greater support, or tap in when maybe a spouse or partner needs a break. And then I like that the Judson team, the Judson family comes around everybody because we can be that additional support in keeping, therapy in the loop. We can have wellness, we have, classes, we have all kinds of things so that we can offer that for each person. And so I think that the visual is wonderful kind of springboard to Comfort Matters, because that's what our Comfort Matters approach for people who have trouble thinking. When we apply this approach, it is like the bullseye. And the whole premise is really to seek every aspect of the person and deinstitutionalize it and make it very person-centered and individualize the care as much as possible. And so that we're able to meet the needs of the body and mind and spirit. And people know whether or not they're comfortable, even if they can't tell us, even if they can't express it. And they can communicate if they're comfortable, but it's going to come through their actions. They're going to be the experts of their own comfort, so we don't have to be. So if they're sharing what their goals are from the very beginning, and they're letting us know what they want and what they don't want, then they're the expert of their own care. What makes you comfortable? Think about that. Is it favorite pair of slippers? You want tea in the morning instead of coffee? Whatever those little things that you enjoy, those should not go away just because you may develop dementia. Those are very important to your being. And so to share that with folks, so in case one day you're not able, then those people who you surround yourself with will provide those things for you. And you'll benefit, and so will they. They won't feel like they're doing something that you wouldn't want. And so that's important, another reason why you would want to share it. These are the 5 key concepts for Comfort Matters. And we look at not just the physical, but the emotional and the spiritual side. We anticipate the needs. If we know you run cold, well, then that's in your care plan. We get a sweater or a blanket on you as soon as you come out of your room. We want to make sure that if you're tired by 2:30, we offer you a different position or have you lie down. And so we're always being mindful of having that proactive care versus chasing whatever is bothering the person. And then that comes with knowing the person and sharing that information. Person-directed care, it means that, sometimes people who were always a night shift person, we're not going to get them up at 5 in the morning. We have to make the care reflect the person. And then finally, staff empowerment. Having the tools, the staff here to know what those things are, what makes the person tick, gives them the go-ahead to do what they need to in the moment for the person. Okay, and so this is tips for dementia care. And I get this question a lot. How come the person isn't doing what I asked them to do? Or how come, they get upset when I ask them for something or I correct them? And so here's 5 big causes. One being fatigue. And remember earlier I said as the disease progresses, they're just really trying to get by in that minute to minute. And so just being able to function in that day-to-day can be exhausting. And so it can be very difficult, especially as the day goes on, to maintain that. And they can become more argumentative or very difficult to interact with. Frustrated. They're very frustrated. I would be too if I want to do something, but I can't any longer. And then fear and confusion. They're probably surrounded with a lot of people who want to help, but if you're not sure why they're there to help, and that can be very scary place to be. The person can also be in pain or discomfort, and it could be arthritis. It could be that they're constipated. It could be that their clothes are too tight. Whatever it might be, but if they have some pain or discomfort, they're not going to perform or go along with the day or the task or whatever they need to do if they're not feeling their best. And then environment. As I said earlier, with spatial relation problems, noise, other things can really increase their agitation, especially if I'm trying to have one conversation, but there's 3 other people talking right next to me. I can't decipher where it's coming from. And so that can be very upsetting. And of course, I won't follow along or I won't do the thing that you're asking because maybe even if the TV's too loud. And so being aware of what's in your environment is really important. How many of you have heard the term sundowning? Well, okay. Well, it's a term we used to use a lot, but I'm asking today staff and family and persons who are interacting with those who have dementia to make a culture shift and really look at language. Sundowning is a term we used to use when people had behaviors like pacing and walking with like wandering, no purpose. They were hitting or pinching. They would try to leave. Well, we've come to know through research and working with persons and trialing different interventions that if a person's comfortable and we've allowed them to rest and we've engaged them meaningfully and they don't have any pain, that they won't have those actions. And so sundowning really is a person's only way of communicating through their actions that they're not comfortable. So that pacing could mean my arthritis is acting up and it's really achy, the weather's bad, so now I'm hurting. But I can't say that anymore because my brain can't do that. And so what do? I pace, I walk around, I've gotta do something, but I can't tell anybody. And so on the outside, it looks like, well, what is she doing? She's walking back and forth. But it's really an action. Somebody banging on the table, you know? Well, what could that mean? Well, it could mean that the environment, the dining room might be too loud, but that person can't say anymore, gee, I'm really just trying to eat my meal, but 5 other people are talking and they're not really making sense. And so I'm just gonna bang on the table. So hopefully somebody will get me out of here, right? And so now that we know that, we're shifting a bit, we're changing, we're even changing in our language and looking at their actions, and they're not just behaviors. And so we have to allow people to work and engage at their own pace. We don't rush people, looking again at the environment, and never argue or reason with somebody. Because again, the brain can no longer do that. And so if you want to go outside and there's 13 inches of snow, and we're trying to tell the person, no, it's freezing, it's cold, why would you want to go out there? They are going to be very upset because they can't recognize that it is cold. Snow does not mean cold. Snow does not mean it'll fall any longer. And so we want to be able to make sure that we give their brain a better offer, and we say, well, how about we go out later? Let's have a cup of tea. You want to distract them or offer them something else. And in fact, you could open the door, because I've done that. And as soon as the door opens up, the person feels that cold hit their face, and they say, oh, it's freezing outside, I don't want to go out there, and they move the other direction. And so sometimes you have to kind of let them figure it out, because if you try to stop them, it can be not a pretty situation. So some best practices: allowing the person to make the decisions when they can and to share that. And in that case, allowing the person to feel the cold and choose something else, like walking back in where it's warm. We want to make sure things are safe for the person, including looking at the floor, looking at the room, how are things set up in the home so that they can monitor and go through the day-to-day that they need to safely. And then constantly evaluate and assess for pain, especially when the person's in that moderate to late stage, because they won't be able to share that. An activity, you want to do that where it's meaningful for the person. And I always share this with folks. You know, I'm an activity director, so I've had to call bingo way too much in my life. So don't ever take me to bingo when I'm old. That's going to be in my care plan. Other people love it, but nope, you'll get probably bingo chips thrown at you if you take me. So it has to be familiar. It has to be, you know, meaningful to the person. And then when things are overwhelming at any stage, and it could be, you know, just that age related, and it's frustrating. Seek help. You know, there are people, even, you know, neighbors or family or friends that you can share that with, or people in, you know, confidential, you know, that you can also share that information. And so I invite everybody, again, no matter what stage, to have that intentional living and to focus on these areas to help put the puzzle together for you. There are a lot of things that we can do day to day, and we can kind of pull in the resources that we need to make us whole, even if it's for an hour, 2 hours, or for that day. And it could be the social worker, therapy, activities. It can be, you know, just a neighbor, but it could be the doctor. But we want to be able to make sure that you are living the best you can. There's no treatment for dementia, and there's no fountain of youth. Although we wish we could stay a certain age, you know, it's going to happen. All of us age. And so these are the things, because there's no treatment for dementia yet, I really, encourage everybody that there are ways in which we can at least maybe stop it or have it a little bit later, down the road. And some of those things are having physical activity. Anything heart healthy is going to be brain healthy. You're eating well. You're taking time for yourself, to just be present with people. Don't get distracted. Don't let that multitasking, get a hold of you. Be present with somebody or enjoy, a meal with someone without the phone or worrying about what you have to do next. And socialize and play. I mean, it's kind of funny, but I think we all still need to play. You need to do things that you love to do, no matter who's watching. And so those things all can help, especially, the getting sleep, or if you are concerned, to seek professional help. These are all things that we can do to make our quality of life the best we can, and we can continue to do that as we age. So thank you all for joining me this afternoon, and at this time, I think we can take some questions.
Yes, and if you are watching virtually, please put it in the chat so we can ask the question aloud to the group. But we do want to open it up to any questions in the room. And thank you, Jessica, for,
welcome.
I have to say, I always learn something new from Jessica every time. And I have used her education in action several times. I always say it would be like my bracelet that says, "What would Jessica do?" No joke. There are times making the brain a better offer helps when interacting with so many people who maybe have thinking problems, and how you can just address issues, especially when they can become challenging, and knowing ourselves, and when we see changes in ourselves as well. But we open it to the room. Student coming here.
So that was wonderful.
Thank you.
If you can do it. It seems to me very demanding of staff, both numbers of staff and intelligence and intuition. And staff is getting scarcer and scarcer. So what's the way out?
Yes, it's a good question. I think education from the very beginning. I think that it's wonderful when I can share my knowledge at orientation. And oftentimes I wish I was like in their classes when they're learning, so that I could share it before they get to us. But I think that the more that we can share what we know, in fact, we just did that this afternoon. We had a coach call with Comfort Matters, and we know that we have an individual moving from the park over to South Franklin. And because we know and have trialed some interventions for this person, we're able to share it and care plan for the person before they get here. And that is so unique. I think that's a fabulous way that we could roll out to the team meetings. We can get information to the staff before that person gets here. Now, can we get to everybody? No, because we do rely on agency and other people to fill in for staff. But if we can put that into point-click care, if we can write that down for somebody, if the nurse knows, if anyone on that shift knows and can share it with that person, that's the ideal. And we really want to make more and more effort to share that information. And then I also have been working with people who are in independent living, and they're just starting to see signs. And it's wonderful. It's wonderful if we can have that information and get supports in, because if that person needs to go to the next level of care and so on, we're going to know them and walk the journey with them. And more and more staff will have that information. So I think sharing that education, how we share it, is really important. And if we know it early and we're not trying to catch up, that's important. Sharing the things at interdisciplinary team meetings have really helped us, because it's not just nursing, it's not just dining. We have security come. They see things on a whim, like, oh, okay, something's going on here. So they're able to share with the team. So even though I know it feels like, we're struggling with the staff, I think the more that we can share, the better. Yeah.
Thank you.
You're welcome.
I will say, things seem to be moving in the right direction here
Thank
in
you.
terms of people actually being out here. So thank you.
You're welcome.
I was thinking, when you were describing the person that wanted to go outside and you let them have a taste of how bitter cold it was out there, does distraction work in a case like that? Could you say to the person, why don't you show me that scrapbook you've been wanting to show me, and then we'll have some hot chocolate or something like that? Does that work in a case like that?
It does. Oftentimes, it's a lifesaver, especially if somebody isn't in a safe situation. Stepping in and offering them the option to go out later, right? Nobody wants to hear no. No, you can't do that. We can't go out there. Nobody wants that. And so if you can offer them, you know what, I think that's a great idea to go outside, but before we do, how about we have hot cocoa and a cookie, and we can look at that scrapbook we've been working on, and we'll go out later. Because what happens is then you get them involved and engaged in another activity, and they forget about going outside.
That was me.
And sometimes it doesn't work. Sometimes it just comes back, and in the next hour, you've got to be more creative. But I feel like, it's a step in the right direction to be able to offer them another means of engagement and distracting them from the icky thing they're focusing on.
Oh, I'm gonna rate your.
Oh, I'm sorry.
I wonder if the practice of meditation has ever been used in connection with treatment of dementia.
Yes, it has. Meditation.
And how?
Yeah, we have done visualization type of meditation where we ask the person to focus on an image, and then we ask them to tell us what kind of emotion it evoked, or a memory or a thought about that. And that has helped to calm a person. It's helped them to become more alert with a focus. And it's actually helped them to recall maybe a memory that they hadn't thought about in a long time. We've used meditation with people who are pretty low functioning, and we meditate with specific music, or if you are just breathing with the person, deep breath in, deep breath out, and doing that right next to somebody can also calm them, and have them breathe with you. And so that's a really good engagement. Yeah.
I'm wondering about, it seems that most of the cases you're talking about, I am assuming, are inside the Crane House or the assisted living. What happens for the people who are independently living, who can see down the road that they're going to need more help, and they've got questions, they don't know, where to take the questions, they don't have a clear understanding or path laid out in front of them. Yes. What's coming next and who can help?
I love that question. It's my favorite question. It starts now. If you have a person in your life and you're not sure what comes next or what supports are there for you. I just did this at the Manor, and it was so wonderful. The wife came to me and said, you know, my husband's having trouble. And so we had a meeting with him because he knows that he was recently diagnosed and he knows he's declining. And so it was an opportunity for him to share what goal he wanted. And he was able to share, I want a break for my wife, right? And so it was beautiful because the wife never heard that. And she was like, well, that's new. Okay, let's put that into play. And so it starts that conversation, and it can be as much as, well, what if something happens to me that he can't function by himself? Okay, so now we back up. What's his routine? What can he do? What can't he do? And he was able to share that. He said, this is where where I would need help if she was out of the picture. Let's say she had to go to the hospital all of a sudden. And so then now what they're going to do is make a list of those things so that if we have a companion that we have to bring in real quick, we know what to do for him already. And so it is important to have that proactive discussion in your, independent living. I mean, that's where we have to start.
But how would you start it?
Just reach out to me or the social worker, Linda Murbar, or Corinne O'Connor, and we can have that meeting. Mm-hmm.
Thank you.
You're welcome.
Other questions? Yes, Dad.
Practically speaking, what do you do if you open the door on the freezing cold snowy day and they walk right out into it?
Yes, I thought that might happen. There were two of us with the person. And I thought, well, if we have to go out in our shoes in the snow, we're gonna go. And so at least there was gonna be two of us with her, with her as she walked out into the snow. And she had a walker, so I was like, let's see how far she gets with that walker, pushing it in the snow. But I have done that. I've actually left with a person who was adamant that we were in Maryland and his house was just right outside. And so I called security and I said, I have my cell phone and we're gonna take a walk. And if I can't get him back, then I'm gonna call you and you can maybe show up with the security vehicle and pick us up. And so we did, and we walked and we walked and we walked. And when I started to feel that he was tiring and we weren't gonna get back, I used what I knew about him and I faked an ankle roll. And he was very concerned about health, the health of his daughters, the health of me. And so now I have an injury, and we call that therapeutic fibbing. And so he helped me back to the building where I said, I know there's a nurse upstairs. And we were able to go back to the floor. And he doted on me all day. He wanted to make sure I had ice, I had water, and we made it through. But sometimes you do have to take that risk benefit, but if you have a backup plan and you have others around you, it gave his brain a better offer. He was pretty tired after walking a lot. And, connected and engaged with me and checked in with me. And he forgot all about going to Maryland. So, yes. Anybody else?
And I will share a quick story because piggybacking off of Jessica. So after Jessica had taught us all about that occurrence, I had a resident who really adamantly was going outside as well and wanted to leave and was in our memory care neighborhood. And I heard the alarm go off, so I come running out. And the thing you don't do, I'm like, don't do it. Don't go, stop, don't go outside. And I put my What Would Jessica Do on, and I walked with the resident outside. It was a 90+ degree summer day, and it was hot out. And I said, I know it's really hot out here. Do you mind if we sit down on this bench for a moment and just take a break? I'd love to, be out here with you, but it's really hot. And then, we sat talking for just a few minutes and I said, I think I need a glass of water. Would you like a glass of water? And then she walked back inside with me to get the glass of water. And, it's that sometimes you just have to reframe it. And I learned that from Jessica and that approach of making the brain a better offer and a part of our comfort matters. And that we can all do that. It's just, your initial instinct has to go away of stop or that's not right or don't do that because it just creates resistance rather than kind of reframing the whole. And you have to let your guard down and change your whole thinking and learn that from all of our comfort matters and from this wonderful person in front of us who has taught so many of us along the way to do things just a bit differently. So thank you all for being here. At the end of all the sessions here, we will have a survey and we'd love your feedback to hear from, how things have gone. Have you learned the things that you anticipated? And just we want to hear your feedback. But our next session in our series is our third one, Getting Ready for a Positive Aging Experience, Mind, Body, and Spirit. And this will be an interactive session with panel experts led by Cindy Struck, our Vice President of Clinical Services here who works across all 3 campuses of Judson. And that's Thursday, October 12th at 4:00 p.m. Please RSVP with Tabitha if you're interested in attending the third session. Yes, Joan.
This has nothing to do with today. Okay. But have you heard anything about the COVID shots?
Oh, so I have now, yes, they are out in pharmacies, COVID shots, but we do not have it through Absolute Pharmacy just yet. As soon as they have it in hand, our goal is to put it out as well and have another COVID vaccine clinic. It's, obviously for the next variant. And so you can't get the old one, you have to use the new one that's in the pharmacies. And as soon as we have it, we will put out a news you can use so you know when those dates are and hopefully we can coincide a bit more with flu clinics, which I don't think will happen though, unfortunately. That would be our.
That would be perfect.
I know it would. I agree, Joan. So as soon as we have more information and we have it in hand, we will most definitely put out the information. A good question. Thank you. Thank you, everyone. Thank you, Jessica.
You're welcome.